brief, and our usual press brief in recent times has been on a Thursday. However, we felt it was necessary to have a conversation today. As I've always said, we monitor the issues around COVID on a almost hourly basis, certainly with the critical public health team players meeting at least twice per day to discuss trends, to discuss findings, to discuss concerns, and to conclude prior to sending out the official release, which sometimes go way into the night, which we apologize for when that is the case. Depending on the mood that we pick up on the ground or the concerns that are raised by the team members, having consulted with the larger team in the field, we have adopted an approach that allows the flexibility to report to the country on this issue in the interest of transparency, in the interest of the country appreciating what is happening as it relates to the COVID response, and certainly to ensure that there's understanding and there is no need for the anxieties that may be as a result of any uncertainty or, frankly speaking, any misinformation. Over the past few days, the public would have seen an uptick, some may describe a surge in the number of COVID cases. We have had discussions around that. The Honorable Prime Minister has had his press brief and has given new restrictions around that uptick or surge. We have discerned, however, in public health that there is still a great deal of anxiety and uncertainty around the numbers, and we are now reviewing the approach that we will take as public health. This, of course, is in keeping to and in collaboration with the government and the Prime Minister, who have consulted on all these issues, but take an approach that is in keeping with the mood, the concerns of the populace, to ensure that panic is not created unnecessarily, to ensure that concerns are consistent with this or encourage action or responses that will address the public health risks that we are confronting, rather than to create a sense of despair or anxiety or indeed panic. So we have decided to have this press briefing today because we felt that there was sufficient information in the environment that would require some clarification, while at the same time an explanation around some of the numbers may be necessary in order to generate a better understanding of what is happening. So I'm going to read through the daily report that we would normally send out to the media, and then maybe just a short statement, and then of course we'll go into the question and answers. So today, the August 23rd, 2020, the past 24 hours, the country has recorded 116 new samples that have tested positive for COVID-19. That's in the last 24 hours. The total number of confirmed COVID-19 cases in Jamaica is now 1,529. The newly confirmed cases are 68 females and 48 males, with ages ranging from 17 to 85 years. The cases were recorded in Kingston and St. Andrew, 51, in St. Thomas, 10, in St. Catherine, 37, in Clarendon, 7, in St. Elizabeth, 1, in Hanover, 1, in St. Anne, 2, in St. Mary, 2, in Manchester, 4, and in Westmoreland, 1. 5 of the new cases are contacts of confirmed cases. 1 was imported from the United Kingdom. 110 of these cases are under investigation. And this, of course, means significant work in contact tracing, which would have commenced once we determine the actual status of the sample. So we should have started as of now, today. In terms of recoveries, 2 additional cases have recovered and been released from care, and total recoveries are now at 819. 71% of patients were repatriated, 71 patients, were repatriated to their countries of origin, and there are now 622 or 40.7% active cases currently under observation. There are 4 moderately ill patients and 4 critically ill patients at this point in time. I want to just briefly update you on hospitalization. I know one of the uncertainties that has been circulating today surrounds concern about COVID beds and our COVID wards and equipment, specifically related to a circular linked to the University Hospital of the West Indies, which they have put out a statement on to say it is incorrect. I've asked them to clarify further, which they will over the next day or so, but it has created some anxieties because the impression has been created that somehow, because of the high number of positive cases, we are now facing a shortage of beds generally because of what has happened, because of the memo coming out of or attributed to the university and the medical officer, the senior medical officer there. So just to clarify, as at 3 p.m. on Sunday, August 23rd, of the 315 COVID beds that are available throughout the public health system, 73 are currently occupied in hospitals across the island, with the greatest admission at the Kingston Public Hospital and at the University Hospital of the West Indies. So 73 of the 315, that would represent about, 25% or thereabouts, or a little above 25% of the COVID beds across the public health system are in fact occupied. Now, it does show an increase in the number of beds being occupied, but it's certainly a far way from any assumption or perception that the COVID wards or COVID beds, which essentially are isolation areas, have been exhausted. We still have sufficient capacity to deal with additional cases that require hospitalization. And I think that is important to be made very clear. In terms of classification of positive cases, 1,529 cases are classified as 435 imported cases, 453 cases that are contacts of confirmed cases, 125 local transmission cases not epidemiologically linked, 236 related to the workplace cluster in St. Catherine, and 280 that are under investigation. Gender classification, some 834 or 55% of all confirmed cases are females, and there are 695 or 45% males. The ages of all confirmed cases range from 2 months to 88 years. In terms of testing, so far we have had 53,390 samples tested, with 51,751 negative and 110 pending. And in the last 24 hours, some 888 new samples were tested. And in the last press briefing we had, COVID Conversations, we did announce that we had cleared up the backlog. And so we are able now to be current, and current meaning a few days, 3 or 4 days. And that therefore gives us real-time information and allows us to respond appropriately in a more efficient time. In terms of state and home quarantine, 15 persons of interest are in quarantine at government facilities, while 29,640 are in home quarantine. I want to say a little bit about the healthcare worker surveillance, and just to mention the Kingston Public Hospital, which again has been in the news in recent days. Concerns raised, which we had confirmed initially that there were 2 positive cases at that institution, regrettably. Normally, when this occurs, there is a process that is triggered automatically, and that process essentially would go into contact tracing, would provide appropriate support to the institution. But it does create some downtime, and it's expected because persons would have to be quarantined where there's uncertainty until test results are had. And of course, to the extent that persons have to be extracted from the work environment, it would put additional pressure on the system to respond to the ongoing needs of providing healthcare services. So there's no doubt that the Kingston Public Hospital has come under a fair bit of stress in recent days due to what has transpired with the positive cases involving medical officers there. I'd like to advise, as a continuation of the announcement that was made, that 8 cases involving healthcare workers have been found through respiratory surveillance and contact tracing of confirmed cases. As a result of those cases, some 31 members of staff of KPH have been placed on quarantine. So 31 members of staff have been placed on quarantine, and over 50 persons have been tested, and we await the results of those tests. Again, I want to just reach out and with a sense and a word of encouragement and understanding and appreciation to the staff, administrative and medical staff at the Kingston Public Hospital, because it is a trying and challenging time for them, and the ministry will give all the support that is necessary to help them to overcome and to go through this process. It is not the first time that we have had positive cases in a hospital setting, but as the country would know, KPH is one of our significant Type A institutions, which carries a significant burden offering our healthcare services, and to the extent that they are affected, it will impact the institution. We do have, however, a protocol or a plan for this type of eventuality. We expect that these things will happen from time to time, so it is not that we are searching for solutions. We are working through the solutions based on a process that is decided on prior to these eventualities occurring. So just to reassure the public that we're doing what we can, and we will overcome and address the situation and to restore some normality to the Kingston Public Hospital. In terms of other hospital workers, our frontline staff are at risk daily. And in the context of the COVID response, we are always going to get disruptions from frontline staff being impacted in one way, shape, or form. Again, there's a process, there's an approach, and while we salute them for their efforts, we understand, and I think they do too, the risks that they face. And I think the country needs to appreciate that, and to appreciate that there is a process to dealing with these cases when they arise. So as part of this surveillance for the continued care of our healthcare workers, routine surveillance has been conducted in all health facilities. Based on these activities, the ministry now reports an additional 9 healthcare workers have been found to be positive, and this is across the system. So in addition to the Kingston Public Hospital, we have an additional 9 in different institutions. And the result or consequences of this is that we have to now clearly isolate these persons, do the same contact tracing that we would do in the community context, and during that period, a number of persons would have to be quarantined until test results are had and they are given a clean bill of health, if you will, and then restored to the work that they would be doing. So we do have a situation where the numbers, as are being reported over the last number of days, are having an impact on the hospital system, because the risk is greater the more our hospital staff have to treat positive cases. If you're only treating 2 cases, it's not as risky as treating 20 cases. And the fact that we have more positive cases means that our frontline staff are more exposed. It's not an issue of a shortage of PPEs, even though sometimes we have to adjust. It really is an issue of the increase in the risk profile of managing COVID-19 in the context of more persons turning up and having had the virus. And I think it's important that be outlined. A couple of things I want to say before I conclude, and then we open the floor to questions. There's been a lot of talk over in recent times about the increasing numbers, positive cases, and we have had a few more deaths, as you know, regrettably. And the system does come under additional pressure when you have more cases to deal with. We did have a conversation around additional staffing, and an announcement was made, 120 medical officers who had graduated recently and had no posts. And the Ministry of Finance did agree to allow those persons to be taken up. I'm happy to announce that that process has moved along now to the extent that we are in a position to engage these persons over the next week, I'm told, by the team here. And that will mean more staff who will be deployed across the country, and that would strengthen the response to dealing with the challenges of COVID and other challenges that we face. And so I just want to make that clear. In addition to that, the community health aides that we have signed up, we have now, I think, 700 of the 1,000 deployed, and that is adding a fair bit of capacity, particularly in assisting us with the contact tracing in the field, which is a key component of our response to the process. I also would like to say that there has been a lot of discussion in recent times around the extraordinary event of election campaigning and the impact of the elections or the campaigning on the COVID numbers. And I've seen some things on social media to suggest that it is because of the campaign why we have these numbers. And I want to just reference a conversation that took place in the previous press briefing, where the chief medical officer outlined, among other things, that a very likely explanation of the numbers that we're seeing today, in addition to other things, and she's here so she can elaborate later on, is the Independence Weekend, where a number of activities took place which would, and based on the timing of that weekend to today and the period that the virus would take to show itself, and the interrogation that has taken place for contact tracing in terms of where persons were, events that they attended, it does show that the part of the surge or the spike that we're experiencing now would be linked more to that weekend and those activities. Now, this is not to say, as some have been saying, that there isn't the possibility of, let's say, nomination day not having an impact in the next few weeks. And that is very likely, because even though I think the political leaders have tried to control and institute the protocols. The truth is, there are evidence of breaches in a number of cases. And so you could have a spike or a surge, but that would not have reflected itself today. There would have to be other reasons, and that would have been part of the reason. But beyond that, ladies and gentlemen, the reality is that we have had a significant restriction being lifted in terms of persons coming in. We have 29,000 plus Jamaicans in home quarantine. And frankly speaking, many Jamaicans are not, many persons are not abiding by the protocols to stay home and to quarantine themselves from family members and friends. And this is definitely showing up as a cause for the increases that we have seen. On the election program, I'd like to announce that in conversation with the Honorable Prime Minister, he has indicated, based on what is happening now with the COVID numbers and also the risks associated with campaigning, that as of today, he is suspending his own campaign activities, meaning the traditional approach to campaigning. And he's certainly going to be asking his, well, the country generally, but also certainly his political organization to abide by that approach. Now, what that would mean is that persons would be engaged in the administrative component of preparing for an election day activity, but the typical approach to campaigning, to meetings and motorcades and so on, the Prime Minister has indicated that he will, as of today, not be engaging in those traditional activities. And of course, that I believe will send a strong message, hopefully to the rest of the country, both to the supporters of the political party that he heads, but also to others, that this is the responsible thing to do in order to mitigate against the possible risk weeks or months down the line of seeing a spike that is linked to political campaigning or political activities. You know, I want to just close by saying that as Minister of Health and Wellness, I am, and I believe with the team that I lead and who supports me, we believe that we need to be very transparent as it relates to this COVID issue. And I think we have been transparent ever since COVID came on the radar. We have had, in some cases, daily press conferences just to update the public and to keep the population in touch with the risks associated with COVID, the measures that we are taking and the measures that they need to take in order for us to have a collaborative effort to overcome the challenges are related to COVID. The truth is that we have, for a long time, stuck by those measures, kept the public informed, tried to address the misunderstandings, and to ensure that we were all traveling together on a similar path. That has led to a number of successes, and the truth is we must take credit, and when I say we, I mean as a country, as a people, Jamaicans, for the successes we have had to date as it relates to the COVID threat. We have had, you know, I looked at the World Health Organization data and got some assistance from our epidemiologists, which shows Jamaica in the top 25% as it relates to deaths per capita, as it relates to number of cases, and this is of 215 countries that are on that list. What that says is that we are performing better than most, better than the next 75% of those countries. And that has to account for something that shows that as a people, all of us, supported by the government, of course, has taken the necessary steps to ensure that we have done the right thing. The wearing of masks, the sanitizing, the 6 feet distancing, all of that, I believe, has been demonstrated in the previous months. It is out of that level of national consensus that we have been able to achieve those numbers, but also out of that national consensus that we have been able as a government to move towards easing some of the restrictions based on a recognition and a need to restore normality. We never shut down. The Prime Minister says that very frequently, and this is in fact the case, but we did impose significant restrictions at our borders, in terms of working hours, in terms of work from the workplace, and persons complied. Once we started to lift or ease those restrictions, and it would have been impractical to expect that those restrictions would remain in place permanently because of the consequences of the lockdown. Once we started to remove those restrictions, there is a sense that persons started to become complacent. In other words, persons were happy for the easing of the restrictions, but were insensitive or not sufficiently sensitive to the need to comply with the protocols that would go with those restrictions. In other words, we were given through orders more rights or access, but it had to be accompanied by more responsibility in terms of abiding by the protocols. And the truth is that many of us, or too many of us, did not or have not been keeping up with the protocols that have been established. And that has created for us a major issue in terms of the surge that we have seen. Jamaicans coming home not abiding by the protocol has been a challenge, a major challenge. Now, we in public health have always anticipated that the numbers would go up because we linked the risks with the decisions that we have made, meaning the opening up. And so one of the things that we are going to have to work on as a country is to accept that while we make the efforts to minimize the positives, and if we follow the protocols, we will still see higher numbers of positives than we would have seen when we had a closing of the borders. And in a sense, it's a narrative that reflects living with COVID as opposed to avoiding COVID altogether, because we have accepted that we can't avoid it altogether. So I use the opportunity to say to Jamaicans, we have a role to play, a very important role to play, and we must play that role. We must renew our commitment to the protocols that exist, the wearing of masks, the 6 feet distancing, the sanitizing. We must help others to understand and appreciate why that role is important, and we must clarify whenever we are in doubt what exactly that role involves or entails. From our standpoint here at the Ministry of Health and Wellness, and indeed from the government standpoint, we will continue to give the support, to give the updates, to give the information, whether it reflects in the minds of people failures or successes. I am committed to ensuring, and I believe the government is committed to ensuring, that we do the right thing all the time in the interests of the Jamaican population. And so if it's bad news, we will give you the bad news. If it's good news, we will give you the good news. We'll work to correct the bad, and we'll work hard to preserve the good. At this point in time, the phase of COVID that we have, the risks, the response that is required requires an all-of-society approach and requires transparency of where we are and where we need to go in order to control these risks. And I want to just reassure the Jamaican people that despite the high numbers in recent weeks, the government is still in charge. The government and the ministry is still on top of the challenge. We are still working to understand daily how the challenge is evolving, and we will do the right thing in keeping you informed and in providing the guidance that is necessary, both at the level of the community, but also at the level of policy. I'm going to close here, and CMO, you want to questions? Thank you.
All right. Thank you very much, Minister. We'll invite our media colleagues to use the raised hand feature on Zoom to ask your question. Just identify yourself and the entity you're presenting. We're going to go to Emma Lewis.
Yes, good night, everyone. Very stormy night. I'm Emma Lewis, blogger. And I'm interested in the cases in Kingston, St. Andrew, 51 cases. I wondered if you could, and new cases today, I wonder if you could elaborate a little bit. Are these still clusters? And also, I asked last time about the R0 number. Wondered if you had any information on that. That's my question. Did you hear me okay?
Yes, we heard your question. To give your response, you had asked about the R0. At the time that I had checked, we had calculated up to the 16th of August, and at that time it was 0.5. In terms of the cases that we have from Kingston and St. Andrew, yes, we do have 51 cases today. The team is really, at this point in time, doing the investigations to find out exactly where these cases are from and if they are linked to any confirmed cases, and to identify which of these cases are part of surveillances that we have done, or in terms of community surveillances around confirmed cases, or whether or not they are identified through respiratory surveillance. So with the large number of cases that we have today, I would just ask the public to be patient while we try to get through all of these cases and to identify exactly who they are and the different links that there are with presently confirmed cases that we have from before.
Thank you very much, CMO. I'm going to go to Janet Silvera.
Thank you very much. I have 3 questions. At least one hotel has said that it has lost 40 bookings to Mexico. Another says they have lost 10% of their bookings. But several hoteliers on a whole are saying that their guests cannot get onto the authorization and are stranded in airports all over the world. Now, there is a site that I went on where I saw several visitors coming to Jamaica who are asking what is happening here in Jamaica. One hotelier went as far as to say that Jamaica's reputation is being ruined. Another one said that they would like to find out why it is that we don't allow the people who have taken the test to come to Jamaica with the test in hand if we cannot manage to give them the authorization on time. So immigration or maybe another set of personnel in the airport could collect the information when they come in. And another thing is, as it relates to the attractions, are we going to allow the attraction operators to start taking visitors, because they say they have spent millions of dollars preparing and being part of a resilient corridor, which they can't understand is not working for them at this time?
Go ahead.
I'll ask the PS to speak to the travel advisory, and I'll address the next.
We're not hearing the PS.
Are you able to hear me now?
Yes.
Okay. All right. So we can report that there was a backlog of travel authorization for Friday and Saturday, the 21st and the 22nd. However, an intervention was made yesterday, given the large volume of persons that needed to be cleared from a health perspective. And we can report today that the backlog has been cleared and all persons who are scheduled to travel have been approved and vetted by the health team. As at today's date, for August 23, which is today, we have cleared all persons, and for tomorrow, we have 273 persons to be cleared, which we intend to complete by tonight. So we will have a complete review of all of the applications on the Visit Jamaica website, and we'll be able to have our visitors come into Ireland based on the requirement to upload their negative COVID test.
Okay, on the other issue of the attractions, again, this is an issue that has been discussed by the cabinet, and any decision around that would have to be a cabinet decision. My understanding is that it will be one of the agenda items tomorrow, and therefore I would not be able to comment on any specifics related to that, except to say the Ministry of Health, provides advice, the cabinet decides, and therefore it really is a decision that the cabinet will deliberate on and will make.
Thank you very much, Minister. Thank you, PS. I'm going to go to Jason Cross.
Thank you, Stephen. Pleasant greetings, everyone. Minister, I have a few questions for you. You mentioned that the PM indicated plans to tone down his campaign, right? Have public health officials recommended that all mass campaigning end, rather than leaving that to the discretion of Mr. Holness and other politicians? Could you use the Disaster Risk Management Act to sort that out? Secondly, could you update the nation on the contact tracing related to Police Commissioner Anthony Anderson? He was tested positive. And could you say what's happening with the sampling of other soldiers and police? Final thing, does the ministry sign off on all sanitization of companies, whether they are small, no matter the size? And yeah, that's it basically.
Okay. I'll ask the CMO to deal with the signing off and sanitizing of companies. I mean, that sounds like a clinical question. But in the first two questions on the public campaigning, I think the Prime Minister has been in the public space, has spoken to his approach to the campaign as it relates to the risks associated with COVID. First of all, he did say in his last press briefing that the campaign would take on a particular approach in keeping with what was put out by the political ombudsman, and then on election day, the protocol that the Electoral Commission has put out. So there are guidelines that have been established, and again, these guidelines were established in consultation with all the political parties, the competing parties. In fact, I participated in a meeting with the political ombudsman, myself, Minister Chang, the General Secretary of the PNP, and shadow spokesperson on health, and the two other parties that were there. And it is out of those consultations that the protocols around campaigning were decided on. Subsequent to that, the PM did have a press briefing where he did indicate that he had discussions with the leader of the opposition around whether we should further tighten some of those restrictions. And there was some general view that we should move towards that based on the numbers and the risk associated. So in short, what I would say is that the issue is not just a self-imposed restriction. It's certainly characterized by consultations, and the public health team normally weighs in on that and provides advice based on what we think is the best approach given the potential health risk. And for now, the advice is, as is being said, that we should minimize the interactions while still preserving, of course, the democratic process without anyone feeling unfairly untreated. On the second question of the commissioner, patient information is confidential, but I did see a release that was put out by the constabulary around his positive case, so it's in the public domain. I would say generally, and the CMO can weigh in here, that as a general rule, all positive cases are subjected to a protocol, which includes contact tracing, interrogation, contact tracing, to assess the extent of spread, and that would involve testing, quarantining, and so on. So if you apply that general rule, it doesn't matter whether it's the commissioner or you for that matter, anybody at all would be subjected to the same arrangements. I will ask the CMO if she wants to comment further on that, but certainly on the issue of companies being sanitized, I'm not sure what the response is there to that.
Thank you, Minister.
There are workplace guidelines and protocols that have been put out, and these are available on our website for all companies in terms of their sanitization procedures. The details of how it is that you do it, with what chemicals, and all of that are listed in those guidelines and protocols, and we would expect that companies would comply, but we do not sign off individually on the sanitization of buildings.
Thank you.
So, excuse me, so would it be that some companies could sidestep the ministry as it relates to this exercise?
But you have to clarify, in what context are you asking about sanitization of buildings? Are you talking...
Okay, specifically when you have suspected cases or a confirmed case.
Mm-hmm. Right, so those investigations are done by the health departments, and the health departments will do an assessment. So if we have a specific activity that is surrounding an investigation, then the health department will work with the workplace team to ensure that the proper measures are carried out. So in those situations, yes, the health department teams do work with the companies to ensure that the proper processes are carried out.
Thank you very much, CMO. I'm going to go to Dion Jackson-Miller.
Thank you so much. First, a point of clarification. I wasn't sure, Minister, when you spoke about the 8 healthcare workers at KPH, if that included the 2 who were reported on Friday, or if it's in addition to the 2, making 10 in all. So I'd like for clarification on that. Also, following up on Jason's question in terms of the commissioner, I hear you in relation to medical info, but I think we're entitled to ask if the commissioner, if the Prime Minister was exposed to the commissioner at any point that would put him at risk, or the leader of the opposition, those 2 in particular. Also asking how many people are now on ventilators and whether any healthcare workers are critically or moderately ill. And finally, I've said to you before that doctors are afraid to speak publicly for fear of victimization. Are you willing to assure us that the doctor who's expressed his views today on social media will not be fired or victimized by the Ministry of Health or SARA?
Okay, Dion, well, thanks again. You've asked quite a few questions. Let me try and recall all of them. The first one involving the commissioner and his exposure. Again, I say there is a general rule that applies to all concerned, that a positive case is assessed, is investigated or questioned for information around contacts, and those contacts are pursued depending on the nature of the contact, and are quarantined, tested, and from there we determine the extent of the risk. This is perhaps our most frequent activity in the COVID response. Most of the cases we have found are as a result of that very same exercise, and I think we've done a very good job at it, and we would not discriminate in that regard. Now, the extent you're asking me whether or not the commissioner was exposed to the Prime Minister or the Leader of the Opposition, the contact tracing process would determine that, and I'm sure both the Prime Minister and Leader of the Opposition would make that public as leaders of the country if that were the case. I mean, I can't speak for the Leader of the Opposition. I don't think the Prime Minister would mind my saying that I did have a conversation with him, but I'm not a contact tracer. But I got the impression based on that conversation that he felt safe based on the extent of any contact over a period of time. But again, that's my informal layman's inquiry of the leader of the country as Minister of Health and the chairman of the cabinet. But the process, the formal process, would take its course. And if any of those persons or anyone else were sufficiently affected, it would trigger an approach that would be in keeping with anyone else who would have been affected. And the numbers at KPH, the 2 is included in the 8, so it's 8 in total. And the issue of the doctor who posted the item on social media, and we all know that I suspect you're referring to Dr. Coombs, who I think is an amazing young doctor. His father before him was senior medical officer in Mandeville, who I worked with. I think he's doing great and will do great. And I have no issues. He has posted an opinion. He's a avid social media personality. We have spoken since that time, and he has expressed a view on certain things, and I've responded. There is no intention, and certainly from my part, and I don't think anyone else, to victimize him or anyone else. What I think is very important is that there is clarity, and to the extent that there is any view that needs clarity, that we provide that clarity, which is one of the reasons too why I said in the initial stages that the extent to which we're seeing a spike, if you will, of cases now is not, in the opinion of the technical team, linked to political activity since the elections were announced. Because, frankly speaking, the time would just be too short to see a manifestation of that. The nomination day activities, which many have been commenting on as a risk, and in some instances it would have represented a risk in terms of transmission, one would not see the impact of that for another few weeks. But as was said earlier in the public space, the Independence Weekend, based on the numbers we have assessed and the interrogation that would have taken place with positive cases, would have had an impact on some of the cases that we're now seeing. And it has triggered the new announcements around some of the suspensions of certain activities, because again, the Prime Minister is very clear, the Cabinet supporting him on this, that if we find that in lifting restrictions things become difficult, then we have to pull back and gradually manage the process, so not as to be overwhelmed by the process. So the short answer to your question is, there's no intention to victimize anyone. That is not my style, and I think we're in a democracy. People can express themselves and should be allowed so to do. But where clarity is necessary, we provide the clarity, and I think in this instance it was important to indicate some clarity around that general perception around the political activity. I think you asked another question. Was it yours, CMO, to respond to?
Right. So in terms of the healthcare workers that we recently announced, we do have one person of that batch of persons that is admitted in hospital but is not classified at this time as being moderately or severely ill. Oh, we do not presently have anybody on ventilator, but we do have 4 critically ill persons.
Thank you very much, CMO. We're going to go to Jamaica Social.
Hi. Happy Sunday evening, if we can say that, under the circumstances of Laura and all we've been experiencing the past couple of days. But Minister, this question is directly to you. I've been looking at what we call our Sunday, and with the numbers that you just announced, since last Sunday we now have we've had 436 cases Sunday to Sunday, and the Sunday to Sunday before that we had 110. That's almost 400% increase in cases. And I lay that as the background to my question that I've asked you when you announced the amount of Jamaicans who were sent home on quarantine. At that time, it was 18,000. And I had said to you, is there any way you can somehow get back through the help of the corporate sector and others to get to a point where you're actually testing people? And I say this to say, I spoke with someone from Barbados yesterday, and they were saying that Barbados regarded this idea or concept as a failure, sending people home to just self-quarantine. It never worked, and they are testing everyone coming into their country. Are you going to get to a point with all that we've seen and the numbers skyrocketing, get to a point where we have to test every person coming into Jamaica? Thanks.
All right. I'm going to ask this CMO to give a perspective on that, but from the perspective of just a general policy of testing everyone, it may appear theoretically as an ideal concept, and I'm sure we strive for that ideal. But there are a few issues with it. Firstly, the practical implementation of it would be a challenge because of the sheer numbers. And I mean, I was asking the CMO when you were asking the question if she knows of any country in the world that actually does that, and we were struggling to identify a country. The general approach has to be more an assessment of risk. I mean, when we had restrictions and persons were only coming in by the hundreds, a few hundreds at a time, or per week, or per day, then testing all wasn't difficult. When you start to get into 2,000 and 3,000 persons coming in on a daily basis, and if you proportionally apply that across the board to other countries based on population and so on, it really becomes a challenge, and then the practicality of it becomes difficult. So what you do is you assess risks, and there are several components to assessing risks. I mean, everyone is screened at the airports or ports of entry, everyone, barring none. So they go through a process, and that process determines who is high risk, who is low risk, and the extent of high or low risk triggers another intervention, ultimately leading to a test. The stay home or quarantining of persons is almost standard globally. So to the extent that we think it is not working, is less a function of the initiative or the process, and frankly speaking, more a function of the commitment to that process by persons who are required to quarantine. One could call it indiscipline. But the truth is, if the 29,000 plus who are coming into the country, who are now in quarantine, and it goes up every day, abided by the 2-week principle, where they would check the temperature, they'd call in. If they had a high temperature or symptoms, they'd call in and be directed. They wouldn't go out, they would mix with family, etc., etc. Then we would have far less cases. So it really now is a function of how we abide by those protocols, not that the process doesn't work, but people, the human element is a major challenge. So I don't know, CMO, you want to come in on as it relates to testing everyone who comes in?
Yes, I think that every country, certainly within our region, struggle with what is the ideal balance to make in terms of testing. How do we balance our resources, both our resources in terms of testing capacity, as well as our human resources, in order to ensure that we monitor our ports of entry as well as to monitor what happens within country. We did carry out the exercise of testing everyone for a 2-week period in June, and this gave us an indication as to what it is that is happening in terms of persons that are coming in. So it gave us the information to inform the protocols that we needed to have in place in terms of the monitoring of those persons. But we never envisioned that it was something that was going to be sustainable based on the amount of resources that it required. Once we have a certain volume of persons that are within country, that are coming from areas that we are going to have the risk of exposure, then it becomes extremely important to monitor the persons that are in country. And so we have had to place our resources there, and it is this exercise in monitoring what is happening in country that enables us to be able to give information, to manage our patients, to contain outbreaks that we see, and to really be able to deliver care to the persons that need it. For persons that are coming into country, a test is a one-off look at what is happening to the person, and we maintain that there is a 14-day incubation period, during which time the person may become positive even though they've had a previously negative test. So all in all, I'm very surprised that anybody should say that the quarantining of persons is unsuccessful, because overall you have a 2-week period to monitor persons for the development of symptoms, and it is that 2-week period that is critical for you to get information and to act early. So it would be very foolhardy to abandon that. And, as I said, every country has to balance the resources that it has and to look at what is the best use of the resources in order to provide containment of infection within country.
Thank you very much, CMO. We're going to go to Damian Mitchell.
Mute my mic as you. Hello? I have 4 questions. I would like to ask them one at a time. My first question goes to the CMO. CMO, did you advise the government to extend the curfew hours during the emancipendence period? Are you hearing me? Are you able to hear me, Stephen?
Right.
Yes.
But you are asking questions in terms of policy direction of the government, which are...
No, I'm asking whether you had extend the curfew hours during the emancipation period.
What do we answer that?
Okay, Damian, I think...
Yes, sir.
I think you should be sufficiently seized with the protocols around public servants and the advice that they give or don't give to governments of the time and the day, and they are not likely. You're putting her the CMO in a very uncomfortable position, and unfairly so, I think, because you're asking her to reveal discussions that she have at the cabinet level, and that's not fair. Go to the next question.
That's fine. No
please.
problem.
Thanks.
No problem. My next question is to you, Dr. Tufton.
Yes.
For weeks, the government had been bemoaning that people had been flouting the COVID rules despite its pleas. Was it then not irresponsible to have failed to tighten the curfew hours during the emancipation period?
Well, I don't know about the first part of your question, because the truth is, as I said in my conclusion earlier, I think for the most part, Jamaicans have complied and have understood the importance of compliance based on the risks associated with COVID. And I think the government has played a fairly good role in keeping the public updated and informed, sufficient to them understanding the risks that were involved. So that account and the manifestations of that, if you were to ask me, would be in how we have performed in terms of both number of positive cases, as well as deaths, as well as hospitalization. I think we have done fairly well when compared globally. Now, it is out of that performance that decisions were taken to ease restrictions. In other words, in a sense, it was reward for good behavior. That may be a crude way to put it, but it's not that people were just totally disregarding. And also, very importantly, the reality that the country could not remain in that state of significant restrictions indefinitely because of the consequences of that on personal life and living and livelihood, which clearly was taking a beating, as is the case globally. So I think the government, in considering all the advice given, but also reflecting on all the other factors, took a decision that they would ease those restrictions, which also included the restrictions around that weekend, Independence Weekend. Today we're seeing the results of it, but the government is doing exactly what it said it would have done if the results of that kind of easing led to an assessment that the risks were not sufficiently avoided. And the Prime Minister has always said that we will ease, but we will pull back if we find that the thing is getting out of hand. And that's what he has done. So I wouldn't use the term irresponsible at all. I would say that it has been a calculated risk, but there are risks involved in risks taking, and the consequences are being addressed as we speak.
My third question, Minister, I get the impression that you're satisfied with Jamaica's COVID containment. Is that based purely on your comparative WHO data, or has there been a detailed review of the COVID measures and their outcomes? And if so, what has that review revealed? And my final question, is the Prime Minister in quarantine?
All right, so I'll answer the last question first. No, he's not. And I have no reason to believe that he will be or otherwise. But the second to last question, though, around my being satisfied is a misunderstanding on your part, and I say so respectfully. I'm never satisfied until we are totally over the hurdle of this public health risk. I'll tell you when I'm most satisfied, when we discover a vaccine and we have come to accept that this is a safe way to prevent COVID, or certainly significantly minimize the risk associated with it. But I am not going to allow the management of the process to be out of, be erratic, or frankly speaking, based on a sense that we project to the populace that we are in crisis and constant crisis. That's not leadership. We have to provide balance, we have to provide guidance, and where the population is responding and responding positively, we have to commend them, we have to encourage them. Where we are moving in a way that seems challenging or risky, then we have to try to correct that. And that has been the consistent approach that we have taken at the Ministry of Health and Wellness, and by extension the government. So it's not a matter of being satisfied, it's a matter of being measured in our response to ensure that the population never ever feels that the persons they elect or appoint to lead a process are themselves in confusion, because we're not. And I'll say that the government is not in confusion, the Ministry of Health is not in confusion around the management of the process, but the process comes with risks, and what we're doing is managing those risks, and I think that's important. That's an important distinction.
All right, let us see how quickly we can take these two questions. Doreen Luton.
Yes, good afternoon. Good evening, Minister Pierce. My quick question, well, two rather. One, with 125 cases, local transmission not epidemiologically linked, are we now losing the battle to contain COVID-19? And the second one is in relation to the political activities. You're always doing projections. What are the projections showing at the end of the political period? Maybe up to the September 23rd or the 2 weeks after that. September 3 or 2 weeks thereafter.
With regards to your question on losing the battle in our fight against COVID, no, I don't think that we have lost the battle or that we are in the process of losing the battle. What I think is that over time, we can expect that our numbers are going to increase, especially if we're in a position where we have released restrictions and persons are able to come into the country. So we are going to see an increase in the number of cases, and it is either that we are going to reach to a point where this virus burns itself out, as that happened with SARS, or it is that it is going to become endemic eventually, and we have to learn to live with this. So what is really of more importance than the numbers of cases is what happens in terms of our management of or moderately and severely ill patients, and how it is that we reduce that number of patients and we reduce persons getting to that stage, and how it is that we prevent deaths. That is really what is most important at this time, because our numbers are going to increase before they start to decrease. And that is what we are at a point now where we have to be fighting harder, because we are seeing more cases of moderate to severely ill persons. And you have noticed that we have had more deaths recently than we've had in a while. So we are at a point where we have to fight harder, because we have to get the message out that persons that are vulnerable will develop severe illness. So, it is up to every Jamaican to fight this battle. It's every Jamaican that has to protect the persons that are vulnerable, to prevent the numbers from rising. We face a severe challenge when our hospitals become challenged with the management of cases, but not only from the management of the cases themselves in terms of the illness of the persons, but also in terms of our exposure of healthcare workers, which can affect how we are able to respond. So we are at a point that we are fighting harder than we have fought in the weeks and months that have passed. But I don't think that we are losing. I think that every healthcare worker and every Jamaican should be up to this battle that we are in. And I think that if it is that we all play our part, that we can come out successful. I remain positive, as the rest of the Ministry of Health and Wellness does, and we work very hard each day to ensure that we are, in fact, providing leadership, providing guidance to the entire healthcare workforce to ensure that we do end up winning this battle.
Can I just come in here from the policy level? It would be a sad day if we started to project any perception, any view that we were somehow losing the battle against any threat to the Jamaican people. The truth is, we always strive to overcome challenges, and we are resilient as a people, and we always overcome. In this instance, we are committed to doing what is necessary to protect the Jamaican people, the government of the day. In the specifics of the COVID response does not, from my perspective anyway as minister, reflect in any way that we're losing the battle or losing control, as was suggested by some earlier. In fact, I go further. When we started to lift restrictions in terms of persons coming in, we were very clear. Look back, we were very clear from day one by saying that we were shifting to a phase where it wasn't about preventing COVID so much as it was now living with COVID, because the risk profile of allowing greater freedom of movement, both in country as well as persons going out and coming in between countries, the risk profile would automatically increase. So frankly speaking, we expected more positives. And I would say expect more positives under this new arrangement. The issue becomes, how do we manage it? And what we did say, as a matter of record, that we were shifting resources, you may recall, away from airports to health centers, from institutional quarantining because we didn't have the facilities, to home quarantining, adding another 1,000 community health aides for greater surveillance and contact tracing. And indeed, what has happened to date is that we have been able to manage sufficiently to contact trace and to pick up cases, and that is an indication that the new approach works. The challenge I have, and I would say all of us have at health and indeed the government, is that too many of us are not complying with the protocols. We would still have had to do a lot of the contact tracing and so on, but the risk would be a lot less if Jamaicans or otherwise coming in observe the protocols around mask wearing, around quarantining at home. We would not have had this level of spike, if you will. And so one of the big issues going forward is to get our people, ourselves, to take on the personal responsibility to make the risk less severe. Otherwise, we really are going to work the public health team, and they could become overwhelmed, and that would require a different response, including pulling back with some and reimposing those restrictions. On the issue of the elections and the projections for elections, I mean, the CMO didn't respond to that, but the issue is really a function of how those activities are conducted. I think there is a very strong signal that has been sent the Prime Minister, and in keeping with the protocols that have been established by the Ombudsman and the Electoral Commission, that the intention is to minimize and in some instances eliminate the traditional approach to campaigning that involve crowds. And that, to my mind, will positively impact the public health risk around COVID. So while I wouldn't venture to give numbers, to my mind, the extent to which we abide by those protocols is the extent to which we'll have much less to worry about.
Thank you very much, Minister. And thank you to all our media colleagues for participating. And I'll just go back to our Minister for his closing remarks.
All right. Thank you very much, Steve, man. Thanks to the CMO and the PS for being here, and to the media for tuning in, and for those other Jamaicans who are listening or watching online or otherwise. I want to just, again, reiterate what my conclusions or concluding statements were earlier. But before that, just to remind the country that we've had 116 new samples testing positive in the last 24 hours, 68 females, 48 males. Most of those cases coming out of the KSA, Kingston and St. Andrew 51, and St. Catherine 37, and the others from a number of parishes across the country. To say also that the University Hospital of the West Indies is making arrangements. They have added challenges in terms of the numbers of persons, but they are making arrangements to accommodate. It is not unusual for hospitals to move patients around in order to facilitate accommodation, depending on where there is a peak demand. And to the extent that something was put out in the public space, they have put out a response to that to indicate that that is fake information. We will continue to work with all our hospitals to ensure that they are sufficiently able to respond. To also say that the Kingston Public Hospital is challenged significantly based on the number of cases that have been discovered, but we will continue to work with them to overcome these challenges, and we want to give full support to the staff there and to the other healthcare workers across the country, where we have had 9 healthcare workers testing positive throughout the country, different parts. It is understandable given the increased stepped up activities in contact tracing and in treatment at our hospitals. It is important that we respond, and the health and wellness of our healthcare workers are absolutely paramount, and we'll continue to monitor that and to respond. More generally, as we move forward, I'd like to remind all Jamaicans to remember that we have a going concern, which is a public health threat, COVID-19. It is in us, in all of us, to play a role to overcome this public health concern. The ministry has a role to play. We understand the role that we must play, and we are playing that role. And to the extent that we need to improve or increase or expand in terms of information and support, we will do that. And the public can be reassured of that. We continue to have faith in the Jamaican people to play their part, and the extent to which we think they can do more, or sections of the society can do more, we will remind you, we will encourage you. But in a time of significant challenge, let us not focus so much on the challenge becoming a crisis. Let us instead focus on the remedies to overcome the challenge. We are a strong people, and you have a strong government that is giving and will give you all the support that is necessary. Thank you very much on this rainy night in Kingston with thunders rolling outside and lightning and all that. Stay safe, and we will seek to keep you updated more frequently as we overcome the uncertainties that I'm sure some of you may feel, given the new numbers that are now being revealed in the last week or so. Thank you very much. Have a good night.
As COVID-19 cases increase,
the date is set. general elections for the year 2020 is therefore Thursday, September the 3rd, 2020.
Even with the COVID-19 pandemic, TVJ News has every beat covered. Join us for Decision 2020.
This team is ready to rescue Jamaica.
We are going to create the new Jamaica.
Decision 2020. Comprehensive election coverage. Weeknights in primetime news and our special election program. TVJ News, keeping you informed.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with